Dr. Kanno Tage from Arunachal Pradesh. And Dr. Tage is a pediatrician and working with government, but also working with an agency called Future Generations in Arunachal Pradesh. So over to Dr. Tage.
Two weeks back, there was a festival of music at a place called Zero in Arunachal Pradesh. People from all over the country came to participate in it. And many of the people I met remarked that the place is so beautiful, but so far away. When they said far away, they meant far away from better roads, the national highways in a neighboring state of Assam. When I told them that most of the villages in Arunachal Pradesh are not even connected with any kind of road, they were too surprised to react, but that is the fact. Inaccessibility has been the main hurdle in all spheres of development in places like Arunachal Pradesh. Apart from inaccessibility, there are other factors as well, like routine political interference in posting of staffs, especially in remote areas, curative-centered approach of the health facilities, inappropriate traditions or behaviors like child marriage, domestic violence, or alcoholism, and general lack of health awareness due to high rate of illiteracy. I want to illustrate the result of all these factors by a finding of a survey that we carried out in 2008. We carried this out in 3 different places in the state. In all the 3 places, we found that 83% of the women preferred home delivery. When this happens, understandably, the delivery attendants are the friends, the relatives, or the neighbors of the mothers who never had received any formal training. Only a small proportion, the doctors and nurses, represented the trained attendants. So this made us ask ourselves, whom are we training? The doctors and nurses? And who are actually taking care of the women in the villages? The second question we asked ourselves was, can we evolve a system in which we can also formally train those sections of the people who are actually working in the villages? So our project to empower mothers as household health workers was evolved. We thought of carrying out an experiment. So our idea was to train one woman from each of the households in a PHC, in the catchment area of the primary health center at a place called Sile in Arunachal Pradesh. That PHC is being managed by Future Generations Arunachal, an NGO, as a part of the public-private partnership of the government of Arunachal Pradesh. So our premise was that the more the number of women who are aware about basic health care in a community, the better health status of that community will be. So what we did was, we selected one woman from each of the 6 main villages in the catchment area with the help of the ushers, so that we had a group of 6 women, and made them attend the primary health center for 15 days. In those 15 days, one of the medical staff would find time to talk to them for 1 hour on selected topics. The rest of the working hours, these women were attached with different sections in the PHC, so that they helped in the workings of the PHC as well as they learned. So that was our simple training design. In 2 years, we could train 149 mothers. And the impact of this, our experiment, we analyzed from the routine records that we kept in the PHCs. We found that outpatient attendance in the PHC dropped over the years, decreased over the years. So was the pregnant women registering themselves in the antenatal clinics. However, the number of women who registered, the pregnant women who registered themselves during the first trimester of pregnancy increased. And so did the institutional delivery. This, we believe, was due to use of different family planning methods by more number of eligible couples in the area. Malaria is an endemic disease in that area. So we took this disease as an illustration of our experiments' impact on the disease burden. So there was a decreasing trend in the number of blood slides examined for malarial parasites. In absolute numbers as well, in both the PF and PV variety, the positive cases decreased. The percentage of positivity also decreased. From this experiment, we like to draw two lessons. Lesson one can be related with WHO's definition of healthcare and health worker. If healthcare comprises of activities whose primary goal is to improve health, and health worker is one engaged in actions whose primary intent is to enhance health, we would like to argue that every productive citizen is a health worker. A school teacher teaching the primary school students, a farmer raising food crops, a carpenter building a house, and a housewife taking care of herself and her family are all health workers. So if we agree on this, so we can ask ourselves, so who is the greatest health workers of all these people? For example, we can compare who is a greater health worker, a specialist doctor working in a super specialty hospital or a mother working at the household level. If we compare this from an individual person's point of view, and if we take these criteria into consideration, so I think you'll agree with me that mother is the greater health worker. So why don't we train the mothers as well? Because they are available, they are accessible, affordable, and acceptable to everybody. This is our first lesson. Coming to the second lesson, first we have to agree with each other that all the healthcare activities, the ultimate objective of all the healthcare activities is production of health at the household level. When only government takes upon the burden of taking care of the health needs of the people, the health production at the household level is very low. When there is some community participation with community mobilization, as is being done under NRHM now, the health production at the household level increases a bit. When this is coupled with decentralized administration, then household production of health increases further. But the household production of health is optimum when individuals at a household level are also empowered to take care of themselves. This is our lesson 2. With these two lessons, our recommendations are recognize mothers as greatest health workers and take steps to empower her to take care of herself and her family. Take forward present agenda of community mobilization and decentralization, as is being done under NRHM now, to household empowerment. And existing health facilities like the PHCs, CHCs, and the district hospitals can be used as community training centers on health. And because the existing infrastructures and existing manpower will be used, this can be accomplished with very minimum additional resources input. Thank you.
Thank you, Dr. Tage. Excellent.